Right, we may have a few more people join, but I'm gonna go ahead and get started. Thank you everybody so much for joining. We're really excited to have a lunch and learn after a bit of a break. Today's lunch and learn the title is Using the First 5 California Kit for New Parents and Partnering with Your Local First 5. Some housekeeping items, just so everyone knows, the meeting is being recorded and it will be posted on the COTAC's website after. We welcome questions in the chat box, so please feel free to send those anytime something occurs to you. So that we can make sure to hear the speakers, please keep yourselves muted, but feel free to raise your hand if you want to be called on and have a chance to unmute. And at the end of the session, we'll be sending follow-up materials and a link to the recording to all of you who registered. And then at the end, we'll also be providing a link to an evaluation survey. And we'll be really grateful if you could take just a minute to complete that so we can get your feedback and continue to improve lunch and learns going forward. All right. And I just wanted to make a formal announcement that COTAC is back. We had to pause a bunch of our services over the summer as we dealt with contract issues, but we're ramping up. So our website is live. We're going to be revising it soon, but all the resources that you usually access are still there. And any questions that you have, you can send to us at oralhealthsupport@ucsf.edu. We have a slightly new team this time around that has a lot of expertise in school-based, school-linked, kindergarten oral health topics, school toothbrushing. And so as we get started here, we'll be developing some resources in those areas, and also we're able to provide technical assistance to LOHPs as you're working on your work plans. We'll be sending out invitations to LOHP directors to do meet and greet with me, the new COTAC leader, and also we'll be sending out a needs assessment. And we really appreciate your input so that we can tailor our resources to you guys. All right, now let's go ahead with today's lunch and learn. It's my pleasure to introduce our speakers. First, we'll have Linda Newhouser and Renetta Syfax give one presentation, and then we'll have Monica White give additional presentation. So, all right, so Linda Newhouser is a clinical professor of community health sciences at the School of Public Health at the University of California, Berkeley. She has a focus on health communication, health literacy, and developing large-scale educational initiatives that benefit diverse populations in California, other states, and globally. She has over 20 years experience in research and practice relating to parent education programs, and she co-heads the Health Research for Action Center at UC Berkeley, a health equity focus group that co-designs, co-implements, and co-evaluates health and education interventions with diverse and underserved groups. And that group produces the California Parent Guide, which is what we're going to be talking about today, which is a resource in the First 5 California Parent Kit. Next, we have Renetta Syfax. She's an information officer with First 5 California. She's managed the agency's Kit for New Parents program since 2009. She has worked in many parts of the state government and brings a lot of expertise to today's talk. I will introduce Monica White, and it's her presentation. So with that, I will stop sharing and let Linda share her slides. Thank you guys for joining today. Looks good.
Thanks a lot, Kristen. So I'm really glad to be here. I will add to what Kristen said that I also work with the Office of Oral Health on another project, which is the Oral Health Literacy Toolkit. We'll talk very briefly about that today, but there will be another lunch and learn for you all about that project. So today we're going to talk about a fantastic free resource, and that's the First 5 California Parent Kit, and how that can be used in local oral health programs. So what we'll be doing is describing the updated kit for new parents, and we'll be talking about how to partner with your local First Five to access, customize, and distribute the kits. And then we'll be sharing examples with you all and ideas from various of the LOHPs here today about partnering with local First Five programs and their ways of distributing the kit. So first, I'll give a very brief history of First Five California. First Five California was established in 1998. It is funded by a tobacco tax that was passed in that year. So there's a whole commission, and the purpose of the use of these taxes is to support programs for children 0 to 5. And there are about 2.7 million of these children in California right now, and their families. First Five programs have many educational and supportive services for parents and children. And Vernetta, I wonder if you might just comment about a few of the programs that you think might be of interest to this group.
Thank you, Linda, and it's wonderful to talk to you all about the kit and about First Five California. As mentioned, the kit is one of the programs of First Five California. We also have programs such as Impact that we manage for the state, and we work with counties to implement, mostly we fund counties to implement programs on the local level to support the initiatives for First Five California. The best way to find out about our programs is to contact your local county commission, though, because they are the ones who implement programs on the local level. But everything that we do is to support parents of children ages 0 to 5. And we have a North Star that we're reaching for, which is to give parents the services and information to provide children with safe, stable, nurturing environments to grow up in, and also to help the state provide equity in services available to those parents.
Oh, thanks, Vernetta. So the way First Five is set up is very similar to the way the local oral health programs are set up. And the local oral health programs, of course, are supported by another tax. So it's a very similar setup. There's a statewide First Five California, and they oversee statewide activities, plus what happens in the counties. Then each of the 58 counties has a county First Five commission, as Vernetta mentioned, and its own program. So these vary by counties. So we would suggest that you go to the website here, CCFC, and find the contact information for your county First Five. You can also see some of the key programs they have when you go to the county information. Now, the Kit for Parents, this was launched in 2001. And the idea here, the commission was very new. So First Five California thought, you know, parents really don't have operating instructions when they have a new baby. They don't even have operating instructions when those babies get bigger and become toddlers and, you know, young children. So they need operating instructions. And the idea was to develop something that would be easy for parents to use, would be comprehensive of the information that they needed to have, and it would also have referrals to local services. So this is intended for parents and caregivers of children 0 to 5 and the providers who serve them. because we've also heard from providers that they don't even have the information that they need. The kits are available in 5 languages: English, Spanish, Chinese, Vietnamese, and Korean. And over the years, there have been a number of evaluations and updates to the kit. The current focus is to reach diverse low-income families, although the kits are available for any families. So how does this relate to the challenges that you all have in local oral health programs and the challenges that First 5 California has to get oral health information to families? Well, for the local oral health programs, often we hear from you all that it's hard to find free, up-to-date, evidence-based, engaging resources that are in plain language and in multiple languages. And we also know that parents and many providers want more oral health information, and they want more than just oral health information. So they would like oral health information that's more in a context of other issues that parents and providers are trying to educate parents about. Sometimes it's hard to find that. Like you might have a brochure that's just on oral health, but you don't have something that's more in context about all the issues. First 5 California is struggling, like we all are, to reestablish partnerships with programs post-pandemic. And First 5 California would like to establish stronger partnerships with LOHPs, with WIC, with Head Start, Early Head Start, Child Health Disability Program, child care programs, all the programs that are in your counties and all the programs that you probably are also establishing partnerships with or would like to. So how can the kit support families and local oral health programs? Well, the kit provides up-to-date, evidence-based, really high-quality information for families. And it includes the key oral health messages, as well as other information that's relevant to parents and caregivers of children 0 to 5 and the providers who serve them. It is written in plain language, meaning that it adheres to health literacy principles. And as I mentioned, it's available in 5 languages. A lot of effort has gone into making the kit culturally sensitive. And it's really important, as Vernetta mentioned, that the kit promote health equity. And this is really a valuable resource, we think, to set up partnerships, because when you go to set up a partnership, it's nice to bring something with you. If you bring a kit with you, then people already see the value that you could bring to, say a WIC program, a child care center, a Head Start, some other program. What kind of oral health information is in the kit? Well, the kit covers all the key oral health messages that are important, beginning with pregnancy through age 5. And it starts with good oral health during pregnancy. So a lot of emphasis on having people who are pregnant be sure to take care of their oral health, be sure to see their dentist. There's a lot in there about healthy foods and avoiding sugary snacks and drinks. Then for, starting with babies, it has information on how to clean a baby's gums. So we want parents to begin really early with oral hygiene for their kids. A lot of parents don't know about how to clean a baby's gums. They think, well, I'll wait till my child gets teeth. But as we all know, you have to start early, because when the child begins to get teeth, they could already be starting on a process to develop cavities. Then how to brush a toddler's teeth. There's information about when children are ready to brush on their own, when children should see a dentist. All of us here are trying to increase the number of parents who get their child to a dentist by around age 1. Then, of course, ways to prevent tooth decay. There's also real important information about how to find a dentist and get affordable care. So there are links to Medi-Cal Dental and all of that information. So let's look at what's in the kit. Vernetta, tell us about the kit.
Okay, thank you, Linda. And again, thank you all for being here. I'm excited to tell you about the kit. If you aren't familiar with the kit is considered a foundational resource that First 5 California provides to parents throughout the state free of charge. And that's really important. We want all parents to have access to this information, but especially, as Linda mentioned, parents from diverse backgrounds, low-income parents. The kit, also as mentioned, was developed. Rob Reiner actually is the one who came up with the idea for the kit for new parents. He said parents in California need a toolbox for children from ages 0 to 5, and the kit is meant to support that. All of the items in the kit are designed, are written with the goal of providing parents with the tools and resources to give their children, their young children, the best start in life. And the materials have changed over the years, but we have a few core items, which are the parent guide, the what to do when your child gets sick book, the baby board book, which has changed a few times over the years, but and also the poison control brochure and magnet. We've also added items as time goes on, such as pandemic related information, mask, etc. Items that support various campaigns. The latest campaign was the Talk, Read, Sing campaign to stimulate childhood brain development by talking and reading and singing to your baby. So let's move on to the next slide, because I'm going to tell you about individual items in the kit for new parents, and also tell you about how to, once we get through that, then I will tell you how to order the kit. The first item is the California Parent Guide, which we work with Linda and her team with. This is a comprehensive publication that we provide to parents. It covers everything from pregnancy to finding childcare and everything in between. It covers developmental stages for children and what parents can look for. Then it covers literacy. We've also included information about the pandemic in there as far as updating this item. And in regards to this group in particular, we have information, just as Linda mentioned, about oral health for children. And sometimes this is something that is overlooked by parents, just as Linda mentioned, in the early stages of life. And oral health is just as important as everything else as far as giving children the best start in life. This one thing I wanted to point out about the California Parent Guide is in every section, there is an area where that says where to find help, that contains information that parents can access resources throughout the state, like agency resources, contact information such as websites and phone numbers. It's very helpful. And also in the back of the guide, there is a comprehensive list of resources that parents can access. So this guide is definitely a critical component of the kit that is not only useful for parents, but for educators as well who work with parents. As Linda mentioned, it's written at an accessible reading level and is available in all of our languages. And we can go on to the next slide. The next item, which is also an item that has been in the kit from the beginning, is the What to Do When Your Child Gets Sick book. This, along with the parent guide, is a very popular item. Some people order the kit just to get this and the parent guide. This book explains to parents when it's appropriate, when they need to take a child to the doctor, or if a child has an illness, what can be treated at home. It's written again in very easy language for parents to access. It's a little out of date with the illustrations, I must admit, but it is an extremely useful book. And again, this is used not only by parents, but by folks who do outreach to parents in educating them, introducing them to the terms in the guide in this book, and how it can be used. And it is written by health professionals. And like I said, it's a core item of the kit for new parents. And we can go to the next slide. Next is our bilingual baby board book. Right now it's números. And we offer this book in all of our languages. So all of the languages are English and the other language that we offer. It introduces babies to the to numbers and to counting. It has bright pictures and colors that stimulate the brain. And it also has textures that babies can reach out to and touch, that develops their, helps start developing those motor skills. And again, this is part of our effort to stimulate early childhood brain development. And it also helps toddlers as well to read. And we can go to the next slide. This book was written by First Five California. It is our 3 Brainy Birds book. We have a version that has words, but the one that we have in the kit is the wordless book. And we have this wordless book to help parents introduce the concepts of imagination and storytelling to their young children. Also, it is very helpful with parents with limited literacy. They can make up stories along with the pictures and engage their children. All parents can do that, but engage their children with storytelling with very young children, and with children a little bit older. They can contribute to the story with their parents. And again, it gets that concept of storytelling going, gets the concept of imagination going, and is part of our early childhood brain development push.
And Bernetta, you've got Brainy Birds right behind you, right?
I do have the Brainy Birds right behind me with the talk, read, sing messaging that we have been, you may have seen some of our commercials over the years. Yes, these are our Brainy Birds. I believe it's Franco, Orson, and Melody. Those are our birds. And we can move on to the poison control brochure and magnet. It's pretty self-explanatory. It's a informational brochure, and it's about how to keep your children, how to safely store hazardous materials, what to do if you or your child comes in contact with those materials. There's a 1-800 number that's provided in the brochure, and there's also a magnet that's attached to it that you can put on your refrigerator. I have one on my refrigerator, and I've seen them in doctors' offices actually. So it's very helpful, and it has good information for parents, just for the, addresses health and safety of children. And we can move on. The next one is a new item in the kit called the Parentage Opportunity Program flyer. We were approached by the California Department of Child Support Services about this. This flyer offers information about a program, a free of charge program that offers California parents the opportunity to establish a legal parent-child relationship. This program is free of charge. So they are trying to get the word out, and we are helping them get the word out about this important program. And we can move on to the next slide. And this is a new item in the kit, the infant, and goes along with this group definitely, but with every group as well. The infant finger, toothbrush, and gum massager. We have put this in the kit to address issues surrounding oral health. And this item helps parents give their children a good start with oral health, and it also teaches children about good dental habits from the start. We are also going to be updating the parent guide, Linda, with information about how to use the brush and the importance of, as Linda mentioned, we already have information about that, but there will be some information specific to this brush in the parent guide. But right now, this brush is in the kit.
And I'll just make an extra comment if I can, Vernetta.
Mm-hmm.
And that is, one of the things we hear from dentists, and we also hear from people working on oral health programs, is that it's really hard to establish good oral health care in the home because parents, they may start brushing their children's teeth when their child is around 1 or 2, but the children often squirm. And one of the things you find out is that if you start with a baby using a finger toothbrush and a gum massager, then they're really used to having somebody have their hands in their mouth. And it makes it really easy then to transition to a child toothbrush and, move on from there. So this is really kind of a magical thing to help advance the goals that we all have.
Yes. Thank you, Linda. And we also have included a KN95 mask for parents. This is to address COVID-19 safety. There was as everyone knows, we've been through a pandemic, and the state of California in all of our programs has been required to address the pandemic through our programs. And this mask is part of us addressing pandemic issues, along with the information that's in the parent guide. And we can go to the next slide. So customizing the kit. All 58 counties that we work with are given the option to customize the kit with information specific to their counties. LOHPs can contact their local first fives, as noted here, about specific resources to be included. Sometimes counties work with agencies, organizations to put in materials in the kit. And so it's best counties are decide on what goes into their county's kits. So you can contact the county, talk to them if you want, or if you'd like to partner with them, putting something into the kit. They are limited to 3 items per kit. So it depends on the county, but I encourage you to contact your county if you are interested in partnering with them about this.
Mm-hmm. And I think we can hear from, later when we have the discussion, we can hear from some of you who are working with First 5 county programs that have put in oral health items into the kit in their county. So those might be things like a child toothbrush, some kind of oral health educational materials, local referrals to, support for oral health of various kinds. So I think it's worth trying, Yeah. It doesn't always work out if there's already 3 items and the county doesn't want to change, but if it does work out, it could be really great for you all.
Yeah, it's a great opportunity. Thank you, Linda. And we'll move on to the next slide. Mm-hmm. And kit evaluation. Yet multiple studies have shown the effectiveness of the kit for new parents. We haven't had a study done in years, but we're actually working on one right now, currently. But in past studies, parents have noted the kit's ease of use and how they share it with family and friends. Also, that they like having everything. They like having everything in one place where they can find this information. And so we are looking forward to getting results of our current study And that is, we can move on to the next slide.
And I'll just add here that the evaluations are important because they also give feedback about things people would like changed in the kit. There's always new information. There's always a way to enhance things. And just like you heard, Vernetta, that people want a parentage resource or a finger toothbrush. You know, these are all ideas people have brought to First Five or had in evaluations, and that does help improve the kit with each edition.
And that is a great point. And we are looking for continuous improvement of the kit. So yes, those evaluations will be very important.
So I could jump in here for a minute. We're going to be hearing from you all about ways that those of you who have the kits are using them with your local oral health program. But some of the ideas that we've heard about from local oral health programs is they can distribute it to parents and caregivers at health fairs and other events. And that gets the word out about your program. As Verdetta just mentioned, a local oral health program could propose a customized oral health resource to have in their county kit. And the kit is really a great way to form partnerships with programs and health and dental practices in the county who could get the kits out. And some of those really key programs would be child care centers, WICs, Head Start and Early Head Start, Child Health and Disability Program, preschools and kindergartens. I know there's a lot of emphasis among local oral health programs to get into the school system early, pregnancy classes, and then outreach to dental practices and HMOs and various kinds of health clinics. These are all places where the kit can be extremely useful. So Vernetta, how do we get the kit? And is the shipping free? I mean, is it free?
It is free of charge, free. We pay for it all. And yes, the kit is available free of charge to all California parents and organizations. There are a few ways that you can access a kit. Parents can go to our parent ordering site for one kit only per kit. It's listed here. And they can order their kit there. For bulk orders, there's a few ways to do it. Probably the best way to receive a bulk order of kits is to email the email address here, which is parentkit@first5.ca.gov. We respond within 3 days to probably the same day when you send your order, and we will place your order for you. All that we ask is that you include the information that is listed here. And also, one thing to keep in mind for very large orders is the storage space. Sometimes organizations will contact us and say, I want 700 kits, and we're happy to send them. But then they receive 700 kits and they're like, oh my God, we don't have the storage space for this. So what we have is we have a subscription. Sometimes, you know, you don't have to order all of your kits at one time. Oh, someone said, if we order kits, would it be specific to our county? If your county customizes kits, then yes, the kits would be specific to your county. All kits contain basic information, which are the materials that I mentioned at the beginning of my part of this presentation, but then your local kit would be customized with items that are provided by that county commission and the organizations they partner with. So yes, you would get only if the county customizes kits. So when you order a kit from this email address, all that we ask is that you include all this information. Again, keep in mind the amount of kits that you're ordering, that you have the storage space for it. I wanted to mention that we have a subscription order option, which is let's say you want 700 kits, but you'd like it delivered over a period of months, you can do that. You can request that we place an order for a certain amount of kits on a monthly basis, bi-monthly basis, whatever you need, we will fulfill that order. You can also, in addition to, I've tried to put a kit on camera with this background. It won't show up very well. I actually have, right now the kits are in envelopes, but we are transitioning to boxes. I'm going to see if I can put this box on camera. So we'll see.
You want to just hold it up, Vernetta? I bet we can see it.
It'll disappear because of the background.
Oh no, but put it up.
I did a little test. Okay.
There you go. If you put it in front of yourself. Yeah.
I see it does kind of disappear, but at least we can see what it is.
It sort of disappears, appears. Well, you'll see the top of the box. This is the new kit. Right now, they're being shipped out in envelopes. This has not been, this is like a sample. These will be shipped out. The boxes will be shipped out in probably late November. We're transitioning to the new packaging. The information inside the kit is the same. We right now ship them in Tyvek envelopes, and then they're enclosed in a reusable bag, which you see on this screen, the reusable bag. The reusable bag is also part in the box. I hope this gives you kind of an idea. Let's see if I can.
Can you do it sideways?
I'm trying to do it sideways, but it's
not very thick. Yeah.
Yeah, it's not, it's actually, this is the, can you see this?
Mm-hmm. Yeah.
Sort of
3 inches or so.
Here we go. There's the, right there.
Mm-hmm.
So that's the size of the kit. I can see if I can find the exact dimensions, but they would be delivered, multiple, like bulk orders would be delivered in a box, and they're usually 5 per box.
Mm-hmm.
And they can be delivered on pallets or delivered to the door in boxes, the delivery, whatever way you need. If you have a loading dock available, we can deliver it to, oh, I love to see that people love the kit. That's wonderful. That's wonderful. You can also contact your local First 5 directly. They will help you place your order for the kit. Also, in addition to that, sometimes the local First 5 will have information about other programs, complementary programs to the kit that they like to offer to individuals and organizations. So I encourage you to contact your local First 5, but if you know, whatever way you prefer, you can contact us. We also have a PDF order form, one that you can either fill out online. There's another version that you can fill out by hand and email that back to us. And I also encourage you, if you have questions, please email our parent kit email address, the same one that I mentioned before, and we'll be happy to answer any questions that you have about the kit or the kit program. Always happy to share information about the kit.
Great. So I would say, you know, the box you have, it's the size of the kit's like a large padded envelope. You know, I got a box of about 5 now, and they're really not that big. So you do have to think about storage, but they're not huge.
It's usually the storage for the bulk, like the bulk orders. When the boxes come in, that is where, because the boxes are a little bit bigger than, they have 5 kits, and then there's some stuffing in there. So the boxes are bulky, but the kits themselves are not.
Great. So after this presentation, COTAC will be sending out the order form. We are also going to be sending out this flyer. There's a flyer that's relevant to oral health, and it talks about oral health in the kit. And as you can see on this flyer, there's information about the bulk orders at the bottom, the same information that Vermetta just talked about, you know, the email address and all the information you should put in your email. And then, it has a little more emphasis on oral health that's in the kit. You can give this flyer, you can just print these out, give them to your partners who might be interested in oral health information in the kit and other information in the kit. So that will be coming to you, the order form and this flyer. And we hope to also be able to send out sample kits to each of the LOHPs. So Kristen, we will be talking about how to do that, but that's what we hope to do. So all of you will get those in the mail, including LOHPs who aren't here today.
You can co-brand with your county commission. There are opportunities to co-brand on items with your county commission. I saw that as a question there.
Yes.
And as far as samples of kits, the first samples that we'll send will likely be in the bag if we can. And if you would like to wait for the box, just let me know and we can send them in the box.
Okay, so we'll work that out for you. I want to mention before we close just a few other resources that you can think about that are useful and that relate to oral health that you might want to use with your partner groups. And the best way to figure out what these are is to go on the COTAC site. All of you should have memorized the COTAC site, but it's right here. There's tons of resources on there. You can go to the Resource Center on that site. You can see, look at these icons and, everything from fluoride prevention programs, educational resources, and smoking issues, sugar sweetened drinks, all of that's here. And there we will have another lunch and learn about the oral health literacy toolkit. So I won't go into that now, but that's a big project that Kristen and I are working on with the Office of Oral Health. And that's to help providers learn how to communicate better with their patients. And there's a lot of really cool videos here, English and Spanish, that you can offer to clients who come to your program. And you can also educate your partners about, they can use these. These are all free. And here's a booklet about Daniel the Tiger going to the dentist, which is super cute. The Sesame Street oral health videos, I just put up 3 of them, but they're all really great. And everybody, I think, knows about Elmo's Brushy Brush video. If you don't, go see it. You won't get the music out of your head, but it's been downloaded, I think, 1 billion times. If you're working with Head Start, they have a great website where there's oral health resources for Head Start. So not all Head Start programs might know about this, so you could, share that information. So let's move now to just hearing from some of you that are using the kits. How do you do it? And, tell us a little bit about your ideas. And I'm thinking especially about Sherry from Stanislaus. I know you guys have been very creative and you use the kits. And Kristen, some of the others here who are doing that.
Yeah, I'm going to ask Sierra Hunt to describe because she's used it in Humboldt County.
Oh, fantastic. Sierra.
Thank you.
Nice to have you here.
You're on mute.
Okay, can you hear me now?
Yes, and I love your background. Thank you.
Thank you so much. This is absolutely fantastic. I can't tell you enough how happy I am to be here today and to see this happening. Several years ago, I think maybe 2018, the California Parent Guide at least came to my attention, and with a background in early childhood education, I just jumped right on ordering the kits, in multiple languages. Good thing you said that about space, because I think I ordered 500 English, 250 Spanish, and they came on these big pallets and these boxes, and I didn't quite realize how much space we were going to need. But we went ahead and started putting oral health information in those bags right away. And, we promote oral health literacy again, like through Brush Book Bed and that campaign, and working with parents on getting that oral health routine going from the beginning. And so we included additional board books in there. So we put like a brush board book with some information about Brush Book Bed. And then we were putting in a finger brush, toddler brush, child-sized brush, and even an adult toothbrush in there with dental floss and a couple of different kinds of toothpaste. We were just loading it up with oral health materials, putting in our Humboldt, Smile Humboldt brochure, a list of dentists in the area. And so, we've been doing that for years. And I'm actually now working with the Office of Oral Health as a program consultant. And of course, as you know, we've got 61 local oral health jurisdictions all across the state. And so I am hoping that we can encourage more of the counties to do this. And I'm going to be happy to offer any technical assistance to the counties that I work with to get this going. We worked with WIC, we worked with Early Head Start, licensed childcare homes, Safe Care, Nurse Family Partnership. We just got all of the programs in our county, together and passed out these bags and asked them that when they handed them out, they could, just talk a little bit about oral health, give a little bit of education, and it just worked fantastic to meet everyone's needs in the community. So thank you so much. And I'm just really happy to be here today.
Great. Thanks, Ciara.
Thank you, Ciara.
Thank you.
Would anyone else like to share what they're doing?
So I think we have a lot of people who have relationships with their first fives, but haven't been using the kit. So this training is coming at a great time. But if you guys have questions from what you've heard, or even more detailed questions about Humboldt County added those things to their kit, or just ideas you have about how you might be adding the kit to what you do, please feel free to add in the chat, or at this point, we're in the discussion time, so it's fine just to unmute yourself and ask.
And one thing that Ciara mentioned that's really important is that when you get the kits, let's say she is going gangbusters with putting all kinds of information in the kit. You can only maybe hope to get one resource in the kit through your county First Five Commission, but it doesn't mean that you can't add anything into the kit bag or the kit box when it arrives at your program. So that's a really cool thing that you did, Ciara. And there's so many great resources out there that you could just put anything in you want.
I also wanted to add about the kit. One of the things that, one of the findings we had in a survey that we did a few years ago is that the kit is often used as a door opener. And what I mean by door opener is when a kit is offered to a parent by a service provider, it gives not only parents access to the information to the kit, but it also is an opener to discussions with the parents between the service provider about what is available to parents in their county. And so a lot of times the kit is used for that purpose as well. So for example, for oral health, giving the parents a kit in your work with oral health can also be a way of, the parent receives a kit, and then it's also a way to open the discussion about what is available to parents in your county.
Yes, and let's say you do outreach to pediatric dental practices. If you do, you have a gift that you can bring them. You can bring them kits that they can then pass out to patients who are pregnant, or to parents of children 0 to 5. And then when they're trying to educate parents, they can find something in the kit that explains what they're trying to highlight, but that's something that the parents can take home and read when they have time and they're not kind of nervous because they're in a dental office. So some people say that really works well. And we did have a comment from, let's see, Elisa Kim saying that you love the kit. Could you, if you're able to unmute, could you say something?
Hi, hello. No, as a, I'm a CST fellow working with the Office of Oral Health. Just seeing this on a bigger scale, because I've seen work of the kits being used in a different local oral health programs, but seeing this being more advocated on a larger scale like this, it does help, and it brings a little smile on my face. And then just seeing it, what exactly is in the kit makes me really, I didn't know how much time and effort is really given into the kit. So I'm glad that these materials are given to the public as well. So, and it's just more of my inputs saying that it's a really great kit being distributed and utilized. So that's comments there.
And
Thank you.
we like your cats too.
Yes.
Thank you. Yeah, there are my 2 cats. Thank you.
And I'll add, I know some of the LOHPs do community outreach. So maybe they go to farmers markets or schools or other events where they're out just bringing awareness to the oral health activities in their county. And this is a great thing to have on your table at the farmers market. Even if maybe people are coming by with older kids, it's still like a nice anchor to have. And for the people that come by with younger kids, they can walk up with something, with a great resource.
Absolutely. I also wanted to mention something about, I wanted to mention for smaller counties, for rural counties, there are some concerns about delivery of kits to more remote areas. We will attempt to deliver kits wherever they're needed. So if you have some special delivery instructions or something like that, we say that we don't accept or we can't process order with PO boxes, but we might be able to work with some, if you're in a rural county or something like that, we can work with you as far as getting kits delivered to your parents.
And you'll notice here on the final slide that, there is information here for how to contact Vernetta and me, and Vernetta's phone number there in case you have questions. So you'll be getting both the email address that you can send out, as well as you've got a phone number here if you have questions, like, if there's special delivery instructions or something, you may want to discuss that.
Great. Okay, I want to make a last call for any other questions for this group before I go ahead and introduce our next speaker, Monica White. All right, and we'll have some additional Q&A at the end, just in case something occurs to you. All right, so it's my pleasure to introduce Monica White. She's a supervising public health educator at San Joaquin County Public Health Services. And she's going to be discussing the San Joaquin LOHP's partnership with First 5 San Joaquin, how their partnership was initiated, and how they maintain their relationship. She will also share some examples of how they've partnered outside of the kit for new parents. Monica assists in the coordination of nutrition education, COVID-19 response, oral health, and tobacco control activities in San Joaquin County Public Health Services. And she joined the team in July 2019. She's a native of Illinois and a graduate of Loyola University of Chicago and the University of Michigan School of Public Health. Over the last 23 years, Monica has held increasingly challenging leadership and management roles in various nonprofit organizations, healthcare systems, and local health departments in Michigan, Illinois, and California. And that is many hats that you wear. So thank you so much for taking the time to share with us today. I'm going to bring up your slides in just a second.
Thank you so much. It's no problem.
Yeah.
I know my colleague, Caitlin, couldn't be here today, so she asked me to present in her place. So I'm happy to be here today and talk with you about our partnership with First 5. And I worked on the oral health program before Caitlin became his full-time or a full-time supervising public health educator. So Okay, so so today, or next slide, I'm sorry. Today I'll be giving you a brief explanation of our local First Fives organizational structure and how our partnership on oral health began. And then I'll dive a little bit into how we maintain our relationship and continue our work together to address oral health for children in San Joaquin County. Okay. Next slide, please. Okay. All right. So each county in California is required to establish a commission to oversee the implementation of First Five activities. So in 2003, the San Joaquin County Board of Supervisors created the Children and Families Commission to oversee First Five San Joaquin. The board appoints the commissioners, which includes representatives from the Board of Supervisors, county departments, and individuals who have an expertise in serving children and families. And so 2 of the 9 commission members are representatives from the health department, including the health department's director, Sienna Blackwell, and our public health officer, Dr. Maggie Park. So First Five of San Joaquin has always been active in health programming that came out of the health department and vice versa. So there's always been a long-standing acknowledgement of oral health and how it's linked to childhood development and the barriers that young and low-income families face when trying to access dental services. So in 2016, the San Joaquin Community Health Needs Assessment, or our CHNA, identified oral health as a priority health need for the county. And that informed a lot of the work in oral health that came soon after. Next slide, please. So public health services in First Five San Joaquin have had a long-standing relationship and have partnered on a number of programs throughout the years. But our oral health partnership has been unique. Are we a little behind? For whatever reason, I feel like we're ahead. I don't know why. I'm looking at 3 different screens at the same time. I'm so sorry. This first 4, let's go back.
Sorry, I tried to unmute myself and I flew through a bunch of slides, so give me just a second.
I'm sorry.
Okay.
So we're going to establishing an intentional partnership. Okay, there we go.
Okay, sorry about that.
I was like, I'm ahead or behind. Okay.
There we are.
So let's see. Okay. So public health services and First Five San Joaquin have had a long-standing relationship and have partnered on a number of programs throughout the years, but our oral health partnership has been unique. So in 2017, First Five San Joaquin was awarded the DTI, or the Dental Transformation Initiative grant from the California Department of Healthcare Services. And First Five used that funding to develop a care coordination program and pilot a virtual dental home program with our local federally qualified health center. So they also established the SJT Collaborative, which brings together our oral health partners and stakeholders quarterly. And so although the DTI funds allowed for the birth of this collaborative group, its foundation was built by both First Five San Joaquin and public health. So after a year, or about a year after the DTI grant started, the LOHP grant was awarded to California counties. So at this time, we scheduled bi-weekly check-in meetings with First Five San Joaquin staff, but we often met more frequently. So public health services did a lot of relationship building with the First Five staff during this time. So together, we would, pour over the scope of work activities for both grants because we wanted to ensure that there wasn't any duplication of efforts. And we also wanted to identify ways that the 2 funding streams could complement each other. So these were highly productive meetings because we were focused on accomplishing the same thing, which is improving children's oral health. Next slide, please. So early on, we started talking about joint messaging on oral health. And one of the best ways to partner with your local First Five is to really collaborate on our joint messaging. So Public Health and First Five San Joaquin pulled our media funds to develop, test, and publish and promote educational oral health messages to the community. So this has allowed us to reach a greater audience with accurate and consistent messages. So albeit those funds are limited, we've really been able to do some impactful messaging. So what does this look like, from day to day? So during our SJT collaborative meetings, we asked our community partners, what kind of messages do we need to develop? And we asked them what kind of myths they are hearing from the community. So Public Health Services and First Five would decide on, topics to address and go back and forth to refine the main messages, sometimes in multiple emails and throughout entire meetings. Our messages are carefully crafted together as a team, and then we work with our media consultant to make it look good. Or as one of my past coordinators said, we want it to look pretty. So often after it's designed, Public Health Services and First Five will go back and forth once again in careful consideration of the layout or how the message will be used to reach the community. So when we aren't sure what the best answer is or we get stuck, that's when we ask the community. And this gives us rich feedback and allows us for greater accountability on all of the work that we're doing. Next slide, please. So although the DTI program ended in 2020, First Five San Joaquin continues to pursue funding to maintain the dental care coordination program. So currently, First Five funds 5 community-based organizations to help families of children 0 to 5 years of age find a dental home. And we're also currently working towards piloting a new referral system called MDRAN, MDRAN, which stands for the Medical Dental Referral and Navigation System. So this platform will be used to receive dental referrals from any medical provider or partner in the county, and care coordinators can pick them up in the system and coordinate them into care. So we also aim to expand dental care coordination into our LOHP school-linked screening program. And then MDRAN was established in Sacramento County for their managed dental care plan. In San Joaquin County, we're piloting the platform in a fee-for-service environment. Next slide, please. Another one of the major ways we partner with First Five San Joaquin is through planning our quarterly SJT collaborative meetings. So although the DTI funds were used to establish a group, Public Health and First Five plans the agendas together, and we take turns presenting and find guest speakers for each meeting. So we also update each other on our planned oral health activities like community events, presentations, and school outreach or screenings. This way we can split up community events among the 2 agencies, or we invite the others like, care coordinators to join us when we're tabling, at health fairs. So in fact, we recently tabled together at our local dental society's membership meeting. At this point in our relationship, we have moved away from meeting bi-weekly and have set monthly check-in meetings. And at these meetings, we still talk about oral health, but we also share updates on other projects and programs that we're working on. So this allows us the time and space to have conversations about embedding oral health messaging into all of our programs. And that's both our health department programs and First Five. Next, please. Okay, so some lessons that we've learned from being a part of this process really is, relationship building is a slow process. Things aren't going to necessarily snap into place very, very quickly, and it won't happen immediately, but those conversations, that is really a rich relationship. And we really, and I think just from taking part in these meetings or even coordinating these meetings has been a really great process. you know, it's not very easy. You know, we all get busy, and sometimes it's difficult to, you know, bring partners to the table to talk about oral health. In the initial stages of our partnership, it was really important for us to find common ground regarding the oral health needs of our community. So in order for us to work together. And then next, you know, ask for their expertise. First 5 have partners that health departments don't. And you want to honor that valuable resource by acknowledging their capabilities. And communication is key, especially when starting out. Regular check-in meetings are a good start. Another way to improve communication is to intentionally loop your partners into email chains, even if they can't respond right away or at all. And then, of course, partnering with them to table or create an event during National Children's Dental Health Month or something like that. You know, it's okay for us to really get together and network with each other. And then last slide, are there any questions? And we included a really cute picture of Stella in this slide.
It looks like there's a question in the chat about, can you please talk a little bit about the referral process? Can you explain that a little more? Who's making the referrals?
Oh, who's making the referrals? So I think I mentioned the care coordinators. So we used to have a lot of care coordinators in the county, and First 5 is now funding 5 care coordination organizations. So they're the ones who are making referrals in the county for dental services. So we see that expanding as we get further into working in this MDRAM process. But for right now, we're working with the 5 care coordination agencies. And I can't remember, I'm trying to remember who all of them are. There's, I know Apsara is one of them. And that's an organization here that focuses mainly on Southeast Asian population. But I can get the names and information of the other organizations if you'd like.
All right, what questions do you guys have for Monica? Feel free to just unmute yourself and ask at this point, or type something in the chat. All right, maybe your presentation was clear. Thank you.
That's great.
So much. You had a lot
so
packed
much.
in there.
I'm sorry, it's Rhoda, and I couldn't get off mute. Can I ask a question?
Yes.
Sure.
So one of the big things that I know MedRan was able to get in Sacramento was the utilization data from the managed care health plans. And that's one of the things that I know for us in Fresno County, it would be really helpful if we could get like a gap in care list, even though we're not managed care, we're fee for service. Were you guys able to get like a gap in care list for individuals that hadn't been to the dentist from your managed care health plan?
Right now, I'm not quite sure where they are with that. I will say that any of the conversations that I've had with people about, oh, you know, would it be possible for us to get data, they seem to not be that open to that. But that's something that I could definitely check into and connect with Caitlin and see if she has more of a more definitive answer for you regarding that. But I understand, you know, access to data is a definite
right,
and especially
I mean,
gap in care data.
For, you know, for the medical side, right? So the managed care health plans, like if you assign so many individuals to one doctor, they get the gap in care list. Like, hey, these are your patients. They haven't gotten their HbA1c. They haven't gotten this test. But the same, I think, for a care coordination team, it would be so great because the low-hanging fruit are the people that go to the dentist. But we know there's individuals that haven't been to the dentist, you know, in many years, if ever. And it would be great if our care coordination team or your care coordination team could really focus on those that aren't going, you know, and understanding the barriers.
Right. And you know, and it's good that you bring that up because there's definitely a quality improvement aspect to that as well. being able to reach out to folks or developing programming that can really help help us work with harder to reach patient populations. So I can definitely follow up with Caitlin about that and see if if they've been able to do that. I'm not quite sure if they have been able to, but like I said, I know whenever I have conversations with folks here about data and EMRs and all that other wonderful stuff, folks are kind of like, we really don't want to share. But I hope we get to the point where we're
Able to share.
Yeah, able to share. They're really able to share.
Oops. All right, well, I want to invite all the panelists and also everybody, just to maybe, since we have a little time, to spend some time sort of brainstorming, either sharing your experiences if you have partnered with your first 5, if you have any other experiences or things that have gone well for your LOHP, please feel free to share that with the group. And also, I think this is an opportunity to brainstorm any additional ways that LOHPs can either use the toolkit or partner with their first 5s.
Hi, this is Magdalene from Sierra County. I will just share a recent collaboration that we had with our local first 5. Thank you to Sierra Hunt. I used her Humboldt County's Brush in a Box program and kind of mirrored that here for Sierra County. And just this week launched it with our local daycare facility. And first 5 funded all of the supplies for them, which was really nice. So we're slowly trying to work, on getting it into the schools. I think that might take a little while. It might be a little bit more of a challenge there. But eventually, that's my goal, is to get there. So that's a great partnership that I felt we had with First 5. And then I also actually have the executive director of our local First 5, who is part of our oral health advisory committee. So she definitely, we're on the same page, which is really, really nice.
That, what, that's interesting. I forgot to bring that up. So my former supervisor is now the executive director of First 5. So we know each other really, really well. So I think that helps solidify our partnership too. I think she's been there for about a year now. And we've also been able to do a lot of joint programming with between our nutrition program and our oral health program, and working with First 5 as well. We just put together our nutrition programming. We just put together some packets for First 5 families around, getting ready to spend a day out at the park, kind of. We put together a massive amount of packets. And it's kind of interesting, Vanetta, when you said people will order 700 and they don't know they can store 700. And we put together 700, and the First 5 was like, we don't know if we can store 700 packets. But we did not have a problem putting them together. And we're really excited about sharing nutrition information and oral health information with First 5 families in conjunction or partnership with First 5. So I think I've just enjoyed the partnership because we've just really been there for each other, and for the families we serve. And so it's not uncommon for us to, really lean on one another. And so that's cool that you say that, Magdalene. I think it's been like I said, a really fruitful partnership.
All right, does anyone else want to share their experiences?
Hey, Kristen, I'll say something again. So the Humboldt Local Oral Health Program, we partnered with our local First Five by going to their play groups. And so we had some, or when I was there, I was an oral health educator, and we also had some care coordinators who would go to the play groups and participate in circle time, you know, sing some songs about brushing your teeth, set up maybe a little table with some oral health resources like the First Five bags with the oral health materials, and just be there to answer questions for parents and to provide materials and resources. So that worked out really well for that partnership. And they just kept inviting us back to come to various play groups across the county. So I think that can be a good thing, you know, as there are more in-person play groups and meetings and get-togethers, that hopefully more local oral health programs can do something like that.
That's great. All right. Well, please feel free to ask more questions. The speakers will be here till 1:30. We'll be putting the evaluation link into the chat box. So please take a moment to complete that and give us your feedback and request future topics. We really appreciate that input so that we can make sure that we choose things that are relevant. And then just as a reminder, we'll be sending out the follow-up materials and the link to the recording after the session. And any questions or recommendations that you have for COTAC, you can contact us at oralhealthsupport@UCSF. Yeah, so the link to the evaluation survey is now in the chat, but you could take a moment and click on it. It'd be great. And feel free to stick around and ask additional questions as well. Oh, and thank you very much to our speakers. We really appreciate you guys sharing your experiences with us today and preparing this great information and resources for the group.
Thank you.
Yes.